May is Mental Health Awareness Month, and there's no better time than right now to find out ways to work on our well-being.
Like many of us, journalist Kelly Corrigan is curious about the best ways to go about doing that. And she has interviewed world-renowned doctors. She's interviewed scientists and experts who are trying to fight this mental health crisis on her PBS program and podcast. It's called Kelly Corrigan Wonders. I mean, mental health is having such a moment, and we keep talking about how a lot of kids seem to be talking more about mental health. They seem to be seeking out more mental health assistance, yet somehow they seem more depressed. That was one of those theories. What are you seeing? What are you noticing?
I'm noticing that in a positive way, there's less stigma, and so people are more comfortable identifying as anxious or depressed. People are super comfortable saying that they're in therapy, which when we were young, you're a little younger than I am, but when we were young.
No, but even when I was young, people wouldn't say that.
It'd be a very whispered thing. It'd be like a confidential. So that's the upside. The downside is that I think that social media and TikTok have such a powerful effect on the way kids enter their identity, that if there's a really cool person talking about how they had a terrible mental health crisis, they might want to join that story.
That's interesting.
Gosh, it's really, that is interesting. And you have older children. We're raising little ones. What have you found helps in this discussion with them? Like, you know, we're talking cell phones and social media. The Surgeon General is talking about all of these statistics. There's an epidemic of loneliness.
Yes. So I think that one thing that we really went after with Kelly Corrigan Wonders in this series on well-being was, can we pull out the science and make it plain for all to see? Just as a model for everyone who's looking for the great next move. And there's so much pop science out there, and there's so much influencer science. And so we went to the best of the best and said, what is reliable, data-backed science? What are takeaways that we can all employ? So one that kept coming up in a really cool way was that many times the message is you need to change yourself, and sometimes with medication. But there's also sometimes this other option, which is to change your context. And when that was coming back to me in these interviews, I thought they were going to say, leave a bad job, leave a hard relationship, move. But and that's all can be true and warranted. But there's also cases where micro changes to your context can have a really significant effect. And we know this.
And this is studied. This is studied.
Totally.
So tell us, like,
such as
for people that are
Well, if you think about what it feels like to be at a busy intersection in New York City and what it feels like to sit in a church pew or a restaurant, you notice that there are these environmental cues in a restaurant or a place of worship where there's lower lighting and there's the scent of candles and there's some organ music. And all of those are nudging our central nervous systems to get into a more reflective space. And that's to our great good. And so then if you think about the role of agency in people's well-being, like so many times people who are depressed say, nothing I do matters. I can't change anything. So just the act of making a small change has sort of a knock-on effect of reminding yourself that there are things you could do. So this isn't going to cure major depressive disorder, but putting on music, standing while you work, calling someone instead of texting someone. Like, there are all these tiny adjustments that you could make that would change the way you experience your day. And our lives are just a collection of our days.
I just want you to get to this one point about changing big behaviors, because we worry about social media, et cetera. And you say you have so much hope.
I do have hope. I have hope because the scientists and researchers that I talk to have hope. I have hope because of very specific things, two of which are, I think that precision medicine is coming to mental health. I don't think that we're going to treat depression as one thing anymore. I think, you know, if my grandma had been diagnosed with cancer, it would have been she had cancer. When I was diagnosed, it was you have HER2 new, ER/PR positive. And this dictates this exact protocol. But right now, we're just trial and erroring people through these SSRIs, et cetera. And that won't always be the case. So precision medicine is coming, says Leanne Williams from Stanford. That was hugely optimistic for me. And then there's also this other piece that made me optimistic, which is an understanding that metabolism is related to mental health. And so Lisa Feldman Barrett, who's top 1% cited scientist worldwide, she's a neuroscientist, said on the show, and then others repeated throughout the 10 episodes, that mental health has a metabolic component, and to the extent that we can understand it, we can fix it.
Wow, that is amazing. Kelly, we need to hear
a whole segment just on that.
You guys can watch Kelly Corrigan Wonders on PBS or listen to her podcast wherever you get podcasts.
We'll be back right after this. Wait, what? Will you give more on that? What? Yeah.